Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Let's practice applying Gravidity, Parity, and GTPAL to determine obstetric history for a patient. First, let's review. Gravidity is the number of pregnancies that a woman has had, and this is going to be regardless of the outcome, just that the pregnancy has happened. Parity is the number of deliveries or completed pregnancies after 20 weeks gestation. To look at the full obstetric history, we are going to expand this further. And so we're going to use an umbrella for parity because a lot of the things we're going to look at are going to fall underneath that parity umbrella. But first, Gravida is going to stay the same. So the G is Gravida, the number of pregnancies. And then in our umbrella of parity, we're going to look at term. And these are our deliveries that have delivered after 37 weeks gestation. Preterm, these are deliveries that happen between 20 weeks gestation to 36 weeks and 6 days. Abortions are any pregnancy that has ended prior to 20 weeks gestation. And then L is for living, which is the number of living children that she has currently. So this makes up a whole line that has G, T, P, A, L. In this example, this says G4, that's 4 pregnancies, T2 is 2 term deliveries, P1 is 1 preterm delivery, A1 is 1 abortion, L3 is 3 living children. Sometimes in prenatal records, you'll also see it written like this. If you see it written this way, the G is still gravida or number of pregnancies, but this P does not mean preterm. This P means parity. So this is the same information again, G4, 4 pregnancies, P or para, 2113 is 2 term, 1 preterm, 1 abortion, and 3 living. So let's take this information and apply it to a patient. So question number 1, Gravida refers to which of the following descriptions? A, the number of times a client has been pregnant. B, the number of times a client has delivered after 20 weeks gestation. C, the number of times a client has delivered a pregnancy before 20 weeks gestation. And D, the number of times a client has delivered a pregnancy. The best answer for this question is A, the number of times a client has been pregnant. So if we look at the rationale, we are reminded that gravida refers to the number of pregnancies. And this is regardless of outcome, and it's also regardless of the number of babies. So if she's pregnant with twins, triplets, quadruplets, it still counts as 1 pregnancy. Every time a pregnancy happens, it counts as 1. So when we look closer at gravidity, this is our number of pregnancies regardless of outcome. We have some other terminology that falls within this. If a patient has never been pregnant, she's considered a Nulligravida because null is 0. If she has had 1 pregnancy or is currently pregnant, she's considered a Primigravida. Prima is 1. And if she has had more than 1 pregnancy, she is considered a Multigravida, so multiple pregnancies. And so it could be 2, 3, 4, however many, more than 1. So in regard to an obstetric history, parity refers to A, the number of times a client has been pregnant, B, the number of times a client has delivered a pregnancy after 20 weeks of gestation, C, the number of times a client has delivered a pregnancy before 20 weeks gestation, and D, the total number of times a client has delivered a pregnancy. For this question, the best answer is B, the number of times a client has delivered a pregnancy after 20 weeks gestation. And so the reason for this is because that we consider the age of viability for this purpose to be 20 weeks. We know that a baby truly isn't viable until a little bit older, but for this purpose, 20 weeks is that cutoff. So parity is the number of pregnancies delivered or completed pregnancies after this age of viability, which is considered 20 weeks of gestation. So this is going to be parity. Any deliveries that happen prior to that are going to be considered abortions. So for parity, this is our number of deliveries after 20 weeks gestation. If she has not had a delivery past 20 weeks, she's considered a Nullipara. If she has delivered one pregnancy past 20 weeks of gestation, she's considered a Primipara. And if she has delivered more than one pregnancy past 20 weeks gestation, she's considered a Multipara. It's also important to remember that multiple gestation pregnancies, twins, triplets, and beyond, are still counted as one delivery, the same as they're counted as one pregnancy. So let's look at our next practice question. A woman has 6 children with 2 sets of twins, and she had one miscarriage at 18 weeks. How should the nurse document her parity? A, 2, B, 4, C, 5, or D, 6? The best answer for this question is B, 4. So let's look at how this breaks down. Since parity is counting the number of completed pregnancies or deliveries that happen after 20 weeks of gestation, regardless of the number of babies per pregnancy, that means that each of her sets of twins are going to count as one delivery. So she's had 6 children with 2 sets of twins, and each set of twins counts as one delivery, and then we're going to count the remaining deliveries from there. So the first delivery of twins is 2 of her children. And then one delivery of twins is 2 more of her children. So that's 4 of her children. So then she has 2 more deliveries for a total of 6 children. So she has one delivery of twins is 1, one delivery of twins is 1, and then the 2 other children makes 4. We have 4 completed pregnancies after 20 weeks gestation. The 18-week miscarriage is going to count under abortion, not parity, because it's less than 20 weeks gestation at delivery. Our next question, a nurse is assessing a woman who is currently pregnant for the 3rd time. She has a history of one miscarriage at 10 weeks gestation and one full-term delivery of a healthy infant. Which of the following accurately describes her Gravida and Para status? A, Primigravida Primipara, B, Multigravida Primipara, C, Primigravida Multipara, or D, Multigravida Multipara? The best answer for this question is B, Multigravida Primipara. So when we look at the rationale for this question, we're reminded that gravidity is the number of pregnancies that have happened regardless of the outcome. Having had more than one pregnancy makes her a multigravida. Parity is the number of pregnancies delivered after 20 weeks gestation, and having had one delivery past 20 weeks makes her a primipara. So she's a multigravida primipara. The miscarriage does not count in parity. Our next question, a nurse is reviewing the prenatal record of a client. The nurse notes that the client is documented as a multigravida and a multipara. The nurse understands which of the following describes this client's obstetric history. A, she has been pregnant more than once and has delivered more than one infant after reaching the age of viability. B, she is pregnant for the first time but has delivered a viable infant previously. C, she has never been pregnant and has delivered one or more infants. Or D, she has been pregnant more than once but has never delivered a viable infant. The best answer for this question is A. She has been pregnant more than once and has delivered more than one infant after reaching the age of viability. So when we look at this rationale, again, gravidity is the number of pregnancies regardless of outcome, and so having had more than one pregnancy makes her a multigravida. Parity is the number of pregnancies completed or delivered after the age of viability. Having had more than one delivery makes her a multipara. For our next question, a pregnant client states that her last menstrual period was on 12/1/2025. She has been pregnant 2 other times, delivering twins at 37 weeks and 1 day, who are now 2, and has had one miscarriage at 8 weeks. Which best describes her gravidity and parity? A. Primigravida Primipara. B. Multigravida Primipara. C. Primigravida Multipara. Or D. Multigravida Multipara. The best choice for this question is B. Multigravida Primipara. The reason for this is because that she is pregnant currently and has had 2 previous pregnancies. So that makes her a Gravida 3, which means she's a multigravida, or she's had more than one pregnancy. However, she has had 1 delivery over 20 weeks, which is the twins. The twins count as 1 delivery. And then her other pregnancy ended in miscarriage at 8 weeks, so it did not deliver after 20 weeks and it does not count in parity. Therefore, she's only completed 1 pregnancy past 20 weeks, making her a para 1, so she is a multigravida primipara. So let's look at her situation again. So her last menstrual period was 12/1/2025. She has been pregnant 2 other times. She delivered twins at 37 weeks and 1 day, who are now 2, and she has had 1 miscarriage at 8 weeks. What is her GTPAL? Is she G3, T2, P0, A1, L2? Is she G3, T1, P0, A1, L2? Is she G2, T1, P0, A1, L2? Or is she G3, T0, P1, A0, L2? The answer for this is G3, T1, P0, A1, and L2, and we're going to look at how this breaks down. So she's currently pregnant and has had 2 other pregnancies. One was the twins and one was the miscarriage. This makes her a G3. The twins were born at 37.1 weeks, which makes them a term delivery because they're greater than 37 weeks gestation. So this counts as 1 term delivery. So T1. There are 0 deliveries between 20 weeks and 37 weeks, which would be preterm. So that P is 0. There's 1 abortion for the delivery at 8 weeks, so it's before 20 weeks, so that's A1. And then she has 2 living children, which are the twins, so that's L2. So here we can see G3, T1, P0, A1, L2. Next question. Jane comes to the clinic for her prenatal appointment. She has had twins at 36 weeks and a son at 38 weeks gestation. What is her GTPAL? Is she G4, P1203? Is she G3, P1103? Is she G3, P1102? Or is she G2, P2003? The best answer for this is B, G3, P1103. So remember, this is that umbrella of parity. So let's look at this closer. So Gravida 3, total number of pregnancies. Okay. Then she's currently pregnant now. She had the twins. That's 1 pregnancy. And then she had her son at 38 weeks. That's her 3rd pregnancy. She's had 1 term delivery at 37 weeks or greater. And so that T is a 1. She's had 1 preterm delivery between 20 weeks and 36 weeks and 6 days, and that's the set of twins that were born at 36 weeks, and the twin delivery counts also as 1. She has had 0 abortions or deliveries prior to 20 weeks, so she has a 0 for A. And then for L, she's got 3 living children. So this is where we'll see the twins. She had the son and then she had the twins, and so she has 3 living children. So in this umbrella of parity, you will think if you see P and then the numbers, that each number, the first one is T for term, then P for preterm, then abortions, and then living. So she's G3, Gravida 3, para 1103. When written this way, the G3 is the number of pregnancies, and the rest of the numbers after the P are breaking down term, preterm, abortions, and living under parity. And it all comes together like this. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.